talk about some other common injuries in skiing. About 1/2 of all injuries in skiing are of the lower extremity, the legs. Next comes the arms, then the head and neck, the thorax and abdomen, and finally the spine. Lower leg injuries are common in skiing. They account for about 1 out of every 20 injuries in skiing, but they used to account for a lot more. They used to account for about 1/4 of injuries in skiing until the ski boots became more rigid, came up higher on the leg, and that has transferred the energy into the knee. And that's why we see so many ACL injuries these days instead of more lower legs that are broken. Another part of your body that you can injure often in skiing is your shoulder. And the way that this would happen is if you were falling and you reached out for the snow and your hands were planted on the slope, but your body continued to travel down the hill. When that happens, your arm is pulled away from your body, and this can result in a torn rotator cuff, which is the small muscles that give stability to your shoulder, or it can result in a shoulder dislocation. The other way to injure your shoulder is to land right on the top of it. And this is more likely to result in a collarbone fracture or in spraining the ligaments on top of your shoulder, which would be an AC or shoulder joint separation.
Downhill skiers can strain almost any muscle with the ski fall. The 2 most common muscles that we see in the clinic are calf strains and hamstring strains. Calf strains can happen when a skier is thrown forward. Hamstring strains often happen in all levels of skiers because we have a quad dominance, meaning the front of our legs is stronger than the back of our legs, and that can create instability and risk for injury. The meniscus is a disc-like piece of fibrocartilage inside the knee that protects the knee joint, and it can be injured with a ski fall as well. Traumatic meniscus tears can occur in isolation, but often occur with ligamentous injury. In fact, 57 to 80% of ACL tears come with a meniscus injury. If the knee is locked after a meniscus injury, that would mean definite surgery. And the surgical options are either repair the meniscus if it's possible, or removal of the part of the meniscus that is torn. Often, we don't know if the meniscus is torn due to swelling and pain limiting testing. If the MRI shows a meniscus tear, it doesn't always mean surgery. If the knee is having surgery for another reason, like an ACL reconstruction, it does make sense to repair the meniscus and preserve as much as possible. In a study, orthopedic surgeons were asked to predict the outcome of 3,880 different clinical cases that were assigned either exercise therapy or surgery. The prediction from the surgeons was correct 50% of the time, the same as a coin toss. Therefore, if the knee is not locked, 6 weeks of PT should be the first intervention, as the ability to predict recovery with or without surgery is poor. Most of what we see as physical therapists in a ski town are overuse and cumulative injuries. These can be caused by poor biomechanics, postural imbalances, not allowing injuries to heal, lack of diversified physical conditioning, and they're important to address right away to prevent long-term disability. Some of these injuries are related to osteoarthritis, which is an inflammation of a joint. Having osteoarthritis does not necessarily mean that you are destined to skiing with pain forever. It can be treated with conservative management, especially if caught early. Knee pain is pretty common in skiing because if you've had a traumatic injury to your knee, you're 4 to 6 times more likely to have osteoarthritis of that knee, whether you've had surgery or not. Another area of the knee that can be bothersome for skiers is the patellofemoral joint. This is the joint that is just behind the patella, which is the kneecap. This joint can be affected with poor biomechanics, and the tracking of the patella on the femur becomes impaired, and then some inflammation can occur and cause some pain. We also see tendinitis in various areas of the body, as well as generalized neck and back pain, which again, all can be treated conservatively if caught early.